Okay, great. There we go. All right. Joanne, thank you so much for joining us today.
Yeah,
Greatly
absolutely.
appreciated. Um, I'm going to ask you right off the bat, what made you choose physical therapy to go into?
Yeah, totally. So I actually had an injury when I was in high school. I tore my ACL, which is a ligament in your knee. So I did that playing basketball maybe when I was a freshman, and then I actually played for a few years on a torn ACL while I was going through rehab, waiting to do my surgery, and then also did PT after my surgery. So I had a lot of exposure pretty much from a young age, and that was when I just sort of started thinking about what I was maybe going to do with my life as I was going into college, and I figured that I really loved the one-on-one aspect of working with people. I'm not really a sit at your desk at an office space type of girl. So that was really appealing to me. And then I loved the rehabilitation and the exercises and the kind of sport specific training. That was really, that really, that really spoke to me when I was going through my rehab. And then as I got closer to making all those decisions, I started I ended up majoring in kinesiology, and then got a lot more exposure to the study of human movement. Was a trainer for a little bit, a personal trainer. I worked as a physical therapy aide. So all those things kind of gave me all the building blocks to be like, yeah, this is what I want to do. And then went to PT school, and here I am.
Okay, so it definitely sounds like the journey was you had a passion for sports and movement already.
Mm-hmm.
And then with the unfortunate incident of having an injury that needed surgery, and
Mm-hmm.
then getting both physical therapy before and after surgery, all that kind of led you to the passionate road you're on now of
Yeah,
recovery.
absolutely. Absolutely. You know, it's funny because when I first wanted to be a PT and then I went through PT school, I really thought I was going to do all of that. I was going to be really sports oriented and ortho, which I, do a lot of. But I kind of started getting more into this holistic, hands-on manual myofascial release, which I'm sure we're gonna talk about in a minute. But it's just funny how the road took me. I got a lot of that exposure during my clinical. So yeah.
Okay, great. So with all that in mind, let's touch base a little bit right now on the
Mm-hmm.
concept of fascia and
Mm-hmm.
myofascial release. So tell me how that works, and then tell me how that you apply to your sessions per se.
Yeah, totally. So fascia is this connective tissue. It's actually more recently considered a new organ in the system because it really has impact on so many things in your body. But you can kind of imagine it like this web-like structure, and it's different textures and different consistencies in different parts of your body. So where you need more structure, like the bottom of your foot, your plantar fascia, you've heard people talk about plantar fasciitis, that's a little bit thicker, a little bit more structurally stable fascia. Same thing with your IT band on the side of your leg. Whereas the fascia around your stomach and all your organs and your GI system, that's all a little bit thinner and more malleable. And it's made up, fascia is made up of a few different compounds. It's collagen, this sort of more liquidy substance called ground substance. And that all varies, the components varies depending on what type of structural, support it needs to give. And what people don't really fully understand, I think they're really still learning a lot about it, is how it impacts all different parts on your body. So you can have restrictions in your fascial system because of trauma or because of, repetitive movement. So you fall on your shoulder, you fall on your hip, you can get, it's basically scar tissue. I mean, scar tissue is basically stuck fascia. So you can get restricted fascia due to like direct impact, or from repetitive movement where your arm or your leg or your hip, it's not supposed to do the repetitive movements for that long, or maybe in that angle, maybe your body's angling at a certain way, and so you can sort of start to get tight fascia. Now where that all makes sense, okay, something's stuck, unstick it or release it and you're fine. But what happens when you have pain maybe like in your hip, but it's coming from your shoulder or vice versa? How does that work? And so I like to talk about the sweater analogy. So if you have pain in your shoulder and something is stuck, maybe your left shoulder, and your pain is in your shoulder, but maybe you're stuck at your right hip. So if you imagine, if I'm pulling on my shirt here, you can see these lines of tension going up to my left shoulder. So if you start to release the tension on the hip, you start to see that little bit of a slack, and then you start moving better. You often have less pain. And then the other aspect is that a lot of times people have pain where they're actually too stretched. They're getting friction, they're getting irritation because the tissue is actually too stretched, not that it's too tight, which is an interesting nugget.
So it sounds like when you talk about the fascial system, and as an example, if somebody's coming in with issues at the shoulder, it could be local at that point, but it could also be from a past non-optimal movement. It could be from a past injury or surgery. So it's one of those situations where, when somebody says, oh, it's all here at my shoulder, it's like, well, it could be, but let's take a little bit greater look at that. Okay. So with that idea in mind, talk to me a little bit about the specialty of the work you do, the clientele you normally see at this point, and what would be like the optimal, client for you.
Yeah, totally. So the work that I do, most of it is manual therapy. A lot of it is hands-on techniques where I'm doing these myofascial releases, and there's a bunch of different ideologies that I've learned from. John Barnes is one of them. He's kind of the guru of the cross hand release, where you're kind of putting the tissue into the restriction, out of the restriction, like stretching it and then holding it. So you kind of see these long holds. It's light. You're not putting tons and tons and tons of pressure. It's more about actually sitting with it and making sure that you're letting the release, completely finish before you just come out of it. A lot of times people don't hold that long enough. So kind of a combination of that. And then also I do a lot of myofascial release through an ideology called IMT. It's called integrative manual therapy, which combines a ton of different people's works and organizations' works that's kind of collaborated into one. This woman, Sharon, in Connecticut, they have a center of IMT in Connecticut. And it's a combination of osteopathic techniques, where you're doing kind of positional releases. There's muscle energy techniques, using your muscles to try to get your body back into alignment. The myofascial release techniques are slightly different, where you actually put the system on slack and you're kind of going more into the area that you're kind of the abnormal movement, and then letting the body, release. And those are all really subtle, light touch modalities. And through the IMT, there's a lot of cranial sacral work where, you're working with the bones in the head, trying to get them, actually the sutures in the head, move more than we talk about, and making sure that those are all moving so that you get the fluid in your brain and your spinal cord, the cerebral spinal fluid, to flow right. And that affects a lot of other things in the body. So again, combination, there's a lot that I just threw out there. It's a combination of a lot of different modalities, mainly hands-on. And then I go ahead and I do a lot of stability training to get people to make sure that we have the stability in order to keep those changes, and self myofascial release work with a ball that I send people home with.
Great. Okay. So it definitely sounds like, from what you've discussed with me already today, that when you go in and you use different techniques on the myofascial, you really have quite an ability to affect many other systems in the body, be it the bones of the cranium, be it the organs, and the intestinal situation. I mean, all of that. So with that idea in mind, tell me a little bit about what a normal first session or session would be like with you.
Yeah, absolutely. So people come in, and I mean, it's really different depending on what the person is coming in with and what, they're also their expectations. I meet everybody where they are, but often people will come in with whatever they're coming in for, whether it's, rehabbing a sprained or broken ankle, or whether they've just gone to a lot of doctors, they have kind of chronic pain and they don't know, they don't know what else to do. And we're looking at the whole system. So whether it's something local or something bigger, most of my assessments and evaluations are pretty similar right off the bat, where I look at the way people are walking. I'm looking at certain functional movements, how their body moves when they're going into a squat, when they're going into rotation, what their spinal movements are looking like, and all the different range of motions of the shoulders and the hips. So I look at the whole body and how it moves on their own. And then I also do my, own assessment of strength, doing manual muscle tests while I have people hold in certain positions, seeing the strength discrepancies between each side. And then that also tells me what's going on, like nervous system wise too, sometimes reflex tests if I need to. So it's your more general overall, like, physical therapy screen that you would expect to see. And then the sort of discrepancies between what I do and a lot of, more typical outpatient PTs is, once people are on the table, I can actually map people's systems. So you kind of push or pull out of the system. You get an assessment of where the restriction is coming from. Yes, you can actually feel the vectors of tension with really subtle pushes and pulls. It's really amazing. And then once I can kind of figure out where I think the primary issue is coming from, then I'll go ahead and hone in on those specific areas and do whatever myofascial release techniques I need to do, whatever activations of the core or, hips that I found during the evaluation. And then at the end, I leave people with a home exercise program.
Excellent. All right. So it is that combination of information gathering, seeing where the movement seems a little altered, doesn't seem to be correctly, then going in and checking with the more manual hands-on stuff to see, okay, where's the origin of the restriction happening, kind of see if we can get that to open up, get the central nervous system to start firing a little bit more correctly. So with all of that, why do you like the combination of teaming up with a Pilates instructor, Fostering Movement Studio, to help the clients? What does that seem to do based in your work?
Yes. I love working with all my Pilates instructors. It's really helpful for me because I do some of the stability work with people, but as you know, as a Pilates instructor, in order to really gain strength, you need to see that at least like 2 to 3, minimum really 3 times a week to see those physiological changes. That's just our physiology. You can't shortcut that. When you need to gain stability and gain strength, you need to be working out a certain muscle group 3 times a week, and you need to be doing it for 4 to 6 weeks in order to really see that change. And so I would rather do the things that I think I'm better at, which is a lot of the manual therapy, and send all the patients that I think really need that core stability work, which isn't crunches. It's a lot of stability through length and getting those deeper core muscles, getting the Kegels of the pelvic floor working together. And I know that you and a lot of the Pilates instructors that I've worked with in the past are excellent at cueing all of that. And so I love sending all of my patients to be doing those either simultaneously or as they wean off therapy, doing more strengthening so that everything is staying the way that it's supposed to.
Excellent. I love I especially love the concept of the team ideology of working together to get people back into better movement in their normal daily patterns. So that's excellent. So Joanne, that is all the questions I have for you today. Thank you so much for taking time out of your day.
Oh my God, it was my pleasure. Thanks so much for having me.
I look forward to working with you here at the studio and getting that, client cross-patterning between the two of us working. So.
Oh my God. Thank you so much. I just realized that I didn't mention about the specialties, that I might just dive in just for 30 seconds about that.
Right ahead. Greatly appreciate it.
I realized I didn't answer that. So a lot of the patients that I work with are, like I said, anything from orthopedics to, more chronic pain people. And I also have kind of a subspecialty of working with women's health. So it's funny, the name's women's health, you would think that that's only women, but it actually includes men's health as well. So it's anything, any kind of pelvic floor dysfunction is a lot of the women's health issues. And so that can mean incontinence issues where you're having like urinary frequency or leakage, that could mean urinary incontinence. It could mean, stool incontinence. It can mean pain during sex. It could mean just pelvic pain or hip pain in general. So there's a lot of different things that kind of come under that umbrella of women's health. And that is definitely something I love working with. I work with a lot of moms or moms to be with issues like that, but you don't have to have had kids to have pelvic floor issues. Huge misconception. So not the only demographic that I work with, but definitely one that I love working with.
Fantastic. And that is, an important part of any physical therapy, any movement business is you're going to see that at some point. It's pretty much a guarantee. So to have a team that has a knowledge in that, very beneficial to the general community. So
yeah, absolutely.
Joanne, thank you so much again for this. Greatly appreciated today.
Thank you.
I will look forward to definitely having you more in the studio and getting the clientele up and running.
Absolutely. Me too. Thank you so much, Jim.
All right. Have a good night. Bye-bye.
Bye.